Yesterday, the Minister of Health, Dr. Sage Ehanire, admitted that Nigeria had been forced to withdraw expired COVID-19 vaccines from circulation, adding that the doses will be destroyed by the National Agency for Food and Drug Administration, NAFDAC. The vaccines were said to have been donated by European countries through COVAX or the AVAT facility, but most of the doses arrived in Nigeria with 4 to 6 weeks left to their expiration dates and could not be dispensed on time, despite the efforts of the health authorities. According to the minister, Nigeria has utilized over 10 million short-life doses of COVID-19 vaccines so far donated to the country in good time and saved more than $40 million in foreign exchange. He said donations of surplus vaccines with expiring shelf lives to low and middle-income countries has been communicated and is a matter of international discussion. Ehanire pointed out that developing countries like Nigeria accept them because they close critical vaccine supply gaps and save scarce foreign exchange procurement costs. He said his ministry shares his experience with partners regularly and now politely declines all vaccine donations with short shelf lives or those that cannot be delivered on time. Now joining us to discuss this new challenge and to tell us what options Nigeria is left with to ensure that it has access to and can procure COVID-19 vaccines with longer shelf lives is the Minister of State for Health, Dr. Olorunimbe Mamora. He will also be telling us what the Nigerian government is doing to ensure that vaccines are distributed to the nooks and crannies of the country and citizens get vaccinated. Good morning, Dr. Mamora, and welcome to the morning show.
Thank you very much. Good morning.
Yes, thank you for joining us. Very quickly, I already gave a summary of the reaction of the ministry to the report that vaccines were destroyed. But we would like to hear directly from you what exactly happened. Is it really about the short shelf lives of the vaccines that were donated through the COVAX and AVAT mechanism by European countries, or it was some negligence perhaps on the part of the Nigerian authorities, and that this is an attempt by Nigeria to just cover up, give an excuse? What exactly is the truth?
Well, let me assure you, thank you very much, Ruben. Let me assure you that it is not an issue of negligence in any way on the part of the Nigerian authorities. Well, if you have a friend or you have friends wanting to assist you because of certain challenge or challenges you have, naturally you will welcome that assistance. But in this particular instance, while we welcome and thank our partners, friends who have decided to assist us in respect of our vaccines need, at the same time, there are challenges that we grapple with, and there's some of which you have said yourself in terms of the manner that these vaccines come in. Don't forget that with the advent of COVID-19, there was, global scrambling for vaccines. But the low-income countries and middle-income countries, they are the worst hit. And Nigeria happens to be one of the countries affected in terms of non-availability of the vaccines. So, but what we saw, or what we have seen, is a situation where the supply of these vaccines from our friends, from our partners, donated to us. We are talking of vaccines that are donated now. The arrival of these vaccines is such that, it's not predictable. It's ad hoc in nature. And that naturally poses the challenge of planning in terms of logistics for deployment, in terms of the cold chain, in terms of readiness, in terms of distribution to the various states, and of course getting to the last mile, so to speak. So, and again, as you said, a number of these vaccines, if not most of them, they have very, very short shelf life. And this poses a challenge of usage. And as a policy, yes, there had been instances where we were told that the shelf life could be extended for us to use. But we have, as a matter of policy, decided that we will not use any vaccines that the shelf life has been extended. That we will rather stay with the manufacturer's specifications. That is, the vaccines that we are using should be such that are within the time limit in terms of shelf life. So these are the challenges. So invariably, we find ourselves in a situation where we have vaccines that have short life and cannot be used up within that timeline. And of course, in such situation, the option that we have is to ensure that such vaccines are destroyed in accordance with international best practices. So that's the situation.
Right, so what is the solution? How do we ensure that we don't get these vaccines that are 5 minutes from expiry and to now have the added insults of them suggesting that we use them beyond expiry date? Does that not affect the potency of the vaccine?
Well, you have said it, the solution. If you ask me, that the most potent solution is for us to have our own vaccine manufacturing hub. That is it. If we are manufacturing these things on our own, then we will not have this kind of challenge. That's the most potent in terms of solution. The other solution is for us to have a predictable supply. What do I mean? That is, let us anticipate this thing months ahead so that we can also plan ahead in terms of receiving and, of course, deploying and putting the necessary logistics in place to ensure this. So those are the two major solutions. Of course, we have the logistics on ground. But again, that is when you have planned. You need to plan for everything that you do. And if you don't have that plan on ground, it may be difficult to effect deployment as appropriate. And don't forget, of course, these vaccines usually arrive in Abuja or in Lagos most of the time. And these are things that we need to deploy to the various states, 36 states, and of course the Federal Capital Territory. And in deploying, we also need to know what obtains in those states and of course the Federal Capital Territory in terms of their need, because we will not just deploy without ensuring that the vaccines we are deploying will be used by the states concerned. So these are the issues. And of course, you recall that you have the AVAT, which is Africa Vaccine Acquisition Trust. Of course, you also have the COVAX facility. So these are the two major facilities through which these vaccines come in. Of course, you then have the bilaterals, that is country to country. And most of the vaccines that come in from bilaterals, they come from our friends, the international partners and all that. So these are the issues.
Right. So you spoke about part of the solution being vaccine, making our own vaccine here. Professor Tomori was here a couple of days ago, and he said something. He said Professor Happy worked with Cambridge University, to bring forth a vaccine candidate. They've since submitted the proposal to the Ministry of Health, to be able to get a vaccine candidate out. And they are waiting for maybe some allotment to be able to do clinical trials. If nothing has been done around vaccine candidates like that for months, then how are we going to get to the point where we get to produce our own vaccines in the first place to solve this problem of people donating about to be expired vaccines to us?
Well, I think the first thing to say is that vaccine manufacturing or vaccine production, I was saying that the first thing to say is that vaccine manufacturing or vaccine production is not something that comes just like that is in a jiffy. It doesn't happen that way. It's a process. It's a process. And you need to go at it stepwise. Yes, you recall that with COVID outbreak, that was probably the first time in the history, in world history, that you had vaccine manufacturing taking place, in less than 18 months. In terms of the entire process, ordinarily, it could take up to 10 years or more from the conception, and of course, moving on to the clinical trials and all that. And with clinical trials you have in phases and all that. But having said that, let me really come back to your question. Let me say pointedly that to say Ministry of Health did not do anything about Professor Happy's effort, that is not true. It is not true. If there haven't been results out there in terms of what we are doing, it does not mean that nothing has been done. And don't forget, the bottom line, at the bottom line of every process in terms of this vaccine production, the major issue is funding. And the funding is huge. Then, of course, the technology that is involved. It's not just the, run-of-the-mill kind of technology. The technology is also huge and complex. And that is why what is happening usually is some kind of collaboration. And even the way we are approaching it in Africa as a whole, and with the support of the global community that we have decided to approach one way or the other, is to pull resources together, because we are stronger when we work together. And I can tell you that at the moment, what is happening is that there is a plan to establish manufacturing hubs here in Africa. And already there are some countries that are being considered as candidates for such hubs. And efforts are in place to ensure that Nigeria is also one of such countries that will be vaccine manufacturing hub in Africa. So in our own little way, we are also involved in that process. You will have the Bio Vaccine Nigeria Limited, BVNL, which is a kind of joint venture between a private sector concerned, and of course, federal government. And that is the main vehicle right now that we are trying to explore in terms of getting our own capacity to manufacture vaccines. But it's a process, like I said, and it's not something that will just come overnight. But we are committed to it.
Okay, Honorable Minister, I would like you to comment further on this particular subject. You mentioned that Nigeria has bio-vaccines, which is a project that is in collaboration with a private pharmaceutical company. The pharmaceutical company in question is Baker. In 2019, in 2020, the Nigerian government talked about this partnership. By 2020, we were told that it had come into effect. 10 billion naira, we were told, was budgeted for vaccine manufacturing. And your principal, Sage Hanire, has been talking about it. As recently as October 2021, he talked about national drug policy and Nigeria's commitment to vaccine manufacturing. If we could do yellow fever vaccine in Yaba, he was saying we'll revive it again. Even in the statement that was issued yesterday to clarify the position about whether vaccines were destroyed or not, Minister Hanire was also still talking about vaccine manufacturing. Okay, the question I would like to ask as a follow-up is this. Where are we with bio-vaccines? Where are we with the partnership with May and Baker? You are right. Yes, Nigeria was mentioned as part of the hub, and that mention was by WHO. Senegal, South Africa, Nigeria, and Rwanda were mentioned. Where are we at the level of that partnership? A conference just ended in Rwanda. It's called the Partnership for Vaccine Manufacturing in Africa, the PAVM. We interviewed Dr. Ebere Okereke recently. Was Nigeria part of that, deliberative session in Rwanda? So it's not enough for the minister to say, oh, vaccine manufacturing is the solution. Where are we? How much progress have we made in terms of the process that you yourself talked about?
What I can say is that it's a process. And with BioVaccine Nigeria Limited, you mentioned the issue of 10 billion naira being set aside for that process, or at least something to assist. But the 10 billion naira that you're talking about is a drop in the ocean when you talk about what is really needed. I talked about the technology involved, the machinery and all that. But BioVaccine Nigeria is still our own candidate that I call the special purpose vehicle for us to achieve that. And when we started, we didn't even have COVID-19. We didn't have that in view because we had gone into this joint venture for the routine vaccines, the polio, tetanus, measles, diphtheria, pertussis. These are the routine vaccines that we were looking at when we had this joint venture thing, when we got it started. So it's about childhood vaccine preventable diseases, tuberculosis and all that. Those were the things that we were looking at. But along the line, COVID came. So we then felt that we might as well just keep that in focus and see how we can establish a vaccine manufacturing hub that would now even take care of these emerging diseases. So that was the basis. And when we discovered that the center in Yaba that used to be what, the center for manufacturing of some of those vaccines where we used to, like the, rabies vaccine and what have you, then the place is no longer suitable for what we propose to have this time around. And even before you can go into that, you will recall that NAFDAC, the DG of NAFDAC, Professor Adeyeye, did say that there are certain things that must even be in place, like kind of precondition. And of course, working with the WHO and some other international partners. In fact, we had, according to her, about 868 items that we must fulfill. Call them preconditions, call them conditionalities or whatever. And working very hard towards achieving this objective, what we call the level 3 maturity. As at today, from the information available to us from NAFDAC, all those conditionalities have been met. And we're just waiting for WHO and the international regulatory agencies that are concerned to now give us that pass mark. So it is then and only then that other things can follow. That's why I said this whole thing is a process. So we are still, in fact, as we speak now, BioVaccine Nigeria Limited is having some, or it will have some meeting with the officials of the ministry, the minister and other officials. I'm supposed to be at that meeting, but when I finish here, I'll have to join them. So we are looking at some of the issues arising, some kind of issues that we need to sort out in order to enable us move ahead. There are some challenges. Yes, I will not deny that fact. There are some challenges, but these are part of the hurdles that we are trying to grapple with in order to be where we want to be. But the important thing to say is that we are on course on this manufacturing of vaccine because that's the best solution. If we have our own hub, if we can manufacture our own vaccines, then we will not need to wait and rely on donations for us to move ahead. Yes, we have some challenges, but we are looking at these challenges and providing solutions to them.
Great. So the recently concluded COVID-19 summit, optimistically themed, pushing through the last mile to end the pandemic. Last mile, when we have this new Omicron variant and also reports of a fourth wave. What measures have been taken to aggressively, hopefully, contain this Omicron variant and the fourth wave to ensure that we are on the last mile of this pandemic?
Well, you see, in a pandemic situation,
do go ahead,
in a pandemic situation, what you aim to achieve is herd immunity. When you apply your vaccines, you are aiming at achieving herd immunity. Because the longer the virus stays in the system, the greater the chances of the virus changing its form, through the process of mutation. And that is why, so to answer your question, I'm saying that we are pushing to ensure that our vaccine coverage for the eligible candidates or eligible citizens of the country is achieved, which is the minimum of 70% at the end of 2022. So if you can achieve minimum of 70 to 80%, then we would have been comfortable that we will achieve herd immunity that will cover everyone as much as possible. But the good news is that what has been established so far is that the Omicron is so far has been established. It's like that. It's just a kind of hysteria. the information based on science, based on evidence, based on data that we have seen so far does not suggest that Omicron is what people even thought or what people have been thinking about it. That is being deadly, being so highly virulent and all that. It is not so far. The evidence available suggests that it is not. So the good thing, again, the other good news is that it will appear from the evidence so far that Omicron is even, is even displacing. If it has not displaced even the Delta variant that was considered to be very deadly. And from one of the reports I read, it was even established that a number of people coming up with Omicron, of course, which can only be established after genetic sequencing, they were found to just, they were not because they were sick, they were just under routine testing that they were found to be positive. They were not even manifesting, any serious symptoms. They were either mild or even not presenting any symptoms at all. So that is the good news. So we are saying that we will continue to work on particularly non-pharmaceutical interventions, like the use of masks, which has been established again to be one of the most potent of all these non-pharmaceutical interventions. Of course, avoiding crowd,
Dr. Mamora,
use of sanitizers, washing of hands, and all that. So these are the issues, these are the things that we're doing.
If you can hear me. There's also bad news. I've listened to the good news you have talked about, but there's bad news. The COVID summit that Tundu referred to, I think I find that very interesting. 3 days ago, the Senate President had cause to complain publicly that nobody from the Ministry of Health was represented at that COVID summit, which was put together by the National Assembly and the Coalition of Development Partners. And he specifically mentioned your name, the name of the minister, and the permanent secretary. And his message to the Ministry of Health is that the Ministry of Health should learn to be serious. What do you say to that? Because this was in the public domain.
Well,
hello, please go ahead.
Well, I hope I had you right because of the. You see, it is not my intention to join issues, particularly with the Senate President, who was my colleague in the Senate, and also, of course, a friend. But that statement that nobody from the Ministry of Health showed up, it is absolutely false. I repeat, it is absolutely false. And I can be quoted on that. Because, yes, I was in Lagos. I was out of Abuja for some other engagement. But the Minister of Health, Dr. Ehanire, was present there. And the information available to me was that as at the time he had to step out to have a very urgent meeting with Dr. Amina Mohammed, the Deputy Secretary General of the United Nations. He informed the Senate President himself. He took a permission, as it were, because that's what respect, dictates. So he took, because I have since found out, yes, I was in Lagos and I had to come in for day 2, which I had also informed both the chairman of the PSC, Presidential Steering Committee, and of course the Dr. Mukhtar, who was in charge as the chief organizer, so to speak, of that COVID summit. So that was to say that nobody was present from the Ministry of Health, that is not the true position. And I have had cause, because I have had cause to explain the situation, the circumstance, to some people that even called me, particularly the friends in the media. It is not true that nobody from the Ministry of Health, from the high officials of the ministry showed up. That is not true. And when the minister finished with the Deputy Secretary General of UN, he went back to join the summit. And the following day, I was there throughout, on the second day. That is the true position. You can verify. But to say that nobody was there, I think that is not the true situation.
Okay, thank you very much.
You may wish to verify this from other sources.
Well, thank you very much, Honorable Minister of Health of Nigeria, Dr. Olorunimbe Mamora. Thank you very much.